Welcome back. In the chapter Communication for Health Education, in today's session, we will be discussing about the contents of health education. Let us begin with the first one. Totally, we have 8 contents: human biology, nutrition, hygiene, family health, disease prevention and control, mental health, prevention of accidents, use of health services. Starting with the first one, that is human biology. Human biology, here we see that understanding health will demand us an understanding of human biology, that is, the structure and the functions of the body and how to keep us physically fit. The need for the exercise, rest, sleep, all of that comprises of the human biology. We also need to understand the effects of alcohol, smoking, drugs on the body, and also the cultivation of healthy lifestyles, etc. So we see that understanding health with respect to the normal functioning and the structure of the body, also how to keep us physically fit, the need for the exercise, rest and sleep falls under the human biology. The UNICEF's State of the World's Children report, they had drawn up the list of health information which every family had a right to know. This UNICEF, they made a list. UNICEF made a list of content which the every family had a right to know. That comprised of this list comprises of child spacing. We had child spacing, and we also had the breastfeeding, safe motherhood, immunization, weaning period, the child growth. During the child growth there could be, along with the child growth, we also had diarrheal diseases, respiratory diseases, the house hygiene. They enable the families to bring their improvement in their children's health. So under the human biology, what you have to remember is, we understand the basic structure and also the function of the body, plus how to keep us physically fit, the exercise, rest, sleep. And along with this, we also study that UNICEF gave us a list which the every family had a right to know, that is regarding the spacing, weaning period, immunization, motherhood, diarrheal diseases, respiratory diseases, child growth, etc. So we are clear with the first point. Now let us move on to nutrition. What was the aim of nutrition education? What did the nutrition education aimed at? It aimed to guide the people to choose a optimum balanced diet. They have to, they encourage the people to choose a optimum balanced diet and remove such prejudices, and also to promote the good dietary habits. Their intention was to promote good dietary habits. And we see that the misconceptions about weaning, and the ignorance of the diet of infant, and the ignorance of the diet of the pregnant women, and this can lead to a lot of problems, and this can better be eliminated. This can be solved by giving an education regarding the nutrition. We see that the appropriateness of the diets of infant and the appropriate diet for the pregnant women can be taught, and the problem can be solved by nutrition education. Also, we have noticed that in the recent years we see that the dietary habits play some important role in chronic diseases of the middle ages, like the obesity. What the people are facing today, the middle aged people, what they are facing, that is obesity, diabetes, cardiovascular diseases like myocardial infarction, that is nothing but the heart attacks. All of this prevalence has increased, and the studies have noted that nutrition plays a role. Nutrition education is a major the intervention which can be made to prevent the cardiovascular diseases, diabetes, and obesity of the middle age. And also it can prevent the malnutrition. We see that the promotion of health and improvement in the quality of life can be brought by the right nutrition education. I hope it's clear. Human biology, what did we see, guys? We saw human biology and nutrition. In human biology, we saw what all was required, and under nutrition, balanced diet, educating or guiding the people to choose an optimum balanced diet, and also to remove the prejudice and promote a good dietary habit is nutrition education. Now let us move on to hygiene. Hygiene, you can see in the picture, very beautifully given. Hygiene, guys, there are two aspects. Okay, hygiene has two aspects. So we see that hygiene has two aspects. One is personal hygiene, and the other one is one is personal hygiene, and the other one is environmental hygiene. Okay, so we see that hygiene has two aspects, personal and environmental. Let us begin with the personal hygiene. So we see that the personal hygiene is nothing but the personal cleanliness, where the setting of the condition where the person lives, he has to keep it clean. Personal hygiene will include oral hygiene, bathing ritual, clothing, washing, and washing the hands after toilet. That is hand hygiene. You can see washing the hands after using the toilet, the care of the nails, and we also have the care of the teeth, that is oral hygiene, the coughing, sneezing hygiene, and also the personal appearance, it falls under the personal hygiene. Training of personal hygiene should begin in the very early ages, and we know that we have this school visits where we go train the kids regarding the personal and environmental hygiene. We tell them, we show the steps how to wash their hands, all those steps, and we educate them, guide them regarding the oral hygiene, the toilet hygiene, and also how to take care of themselves. Environmental hygiene again is divided into two aspects. See, environmental hygiene again, it is divided into domestic hygiene and community. Domestic and community. Okay, so how do we divide hygiene so far? Let us see. So hygiene is divided into personal hygiene and environmental hygiene. Under environmental, domestic and community. Community and domestic. So we see that the domestic hygiene is the of the home, the use of soap, need of the fresh air, ventilation, the lighting of the home, all regarding the home. Hygiene, storage of food at home, the disposal of waste, and also to avoid the pest, rats, mice, insects at home. All that falls under the domestic hygiene. Now we move on to the environmental hygiene. Improvement in the environmental health will be a major concern for the government. In the developing countries, we see that in the basic, so we see in domestic, we have completed this light, air, ventilation, disposal. Now we are dealing with environmental hygiene. This is domestic. Then we have community, right? Environmental, domestic, and community. Domestic deals with the house at house, the lighting of the house, the storage, and everything. So this was about the house, air, light, ventilation, disposal of waste, and etc. Now we are going to discuss about the community hygiene. In community hygiene, you can see that in the developing countries like in India, a major emphasis is made in the improvement of these sanitary services, water supply, clean water supply, clean drinking water, and then the disposal of the human excreta, the disposal of solid and liquid waste, food sanitation. These were very fundamental to health. In many areas, we find the poor sanitary practices among the people because of their old customs and their styles of living and habits. They used to believe, people in rural areas still believe that having water sealed sanitary latrines is unhygienic. They cannot have the the dirt in the house, so they prefer open field defecation. So we know how bad it is. So the right environmental education can solve most of these problems. Now we move on to family health. Family health largely depends upon the family's social and physical environment, and also its lifestyle and behavior. So we see that the family health, what does it depend on? Their behavior, the family's behavior, their environment, also where the family is residing, their environment, their social beliefs, and also their lifestyle, upper class, lower class. So we know family health, if it is low class, poverty is there, and the respiratory diseases and malnutrition, all such diseases will be there. And in upper class, we see obesity, cardiovascular diseases. So also the family health depends upon their lifestyle and the social status. The role of family in the health promotion and prevention of disease, in the early diagnosis of disease and the care of the sick individual, plays a very crucial importance. And we see that the prevention, the child rearing and self care, the main task of this health education. Now we are studying about health education, right? In health education, we see that the main task of this health education with regard to family health is to educate the people for the family's self reliances regarding the responsibilities in childbearing. It's childbearing and child rearing. We also see that the self care and influencing the children to adopt a healthy lifestyle. So these families will play a very important role during this period of childbearing, and how they raise the child rearing, and how they promote the child to adopt a healthy lifestyle. Their attitude, their belief will also influence the children to adopt a healthy lifestyle. Moving on to disease prevention and control. Prevention and control of locally endemic diseases. We see that the medicines or the drugs alone, regarding the disease prevention, the medicines alone will not solve the problem without the health education. They alone cannot solve. Health education is very important. The experiences in western countries, they show that the eradications of like the diseases like cholera, malaria, typhoid, all of these were eradicated with the help of health education. They educated the people regarding the disease. Now the best example you can take here is of that of corona. So the pandemic disease like in corona, where the health education regarding the disease and how to prevent it was given to the population and the community using various medias. So with the knowledge of this education regarding the disease, they were able to prevent it. The disease prevention and control of locally endemic diseases is the essential activities in the primary health care. We see that these public health programs on a national scale are to eradicate diseases like TB, leprosy, malaria with the help of health education. Now, regarding the mental health, now we move on to mental health. Mental health problems are seen everywhere. You know, there is a rise in cases, there is a tendency of rise and increase or a rise in mental diseases where there is a change in the society. The people who were residing in rural areas, who had lots of, interpersonal communications with the people, they migrated to an industrial economy where people who were having a warm intimacy with their village community, now they have brought into this industrial areas in the big cities where isolation is seen. We see the large apartments, we do not know who our neighbor is today. How many of you know who are your neighbors, what are they doing. We know nothing about them. Everybody is indulged completely in their own family, in their own affairs. So we see that when a warm intimacy which was found in the village, and now they have migrated to the cities, they are lacking that warmth, and then it leads to mental breakdowns. The aim of this mental health education is to help the people to remain mentally healthy and prevent their mental breakdowns. What is the aim of mental health? To keep the people mentally healthy and to prevent the mental breakdowns. So, there are certain special situations where mental health is of a great importance. As the physicians, you have to know in certain critical conditions, like widowhood, or like starting a new family, or a decision about the future career. At that time, there are crucial periods where the pressure will tend to break down the mental health. So, we should achieve the mental health in the people by showing them sympathy, empathy, understanding them, making certain social contact. We also see that in the kids, when the child is going to the school for the first time or is entering his secondary school, the mental health plays a major role. And also the mother after the childbirth, her mental health also have to be taken care of without any mental breakdowns, by showing some understanding and sympathy. Now, moving on to the prevention of disease. Accidents, we see they are a complexity which is found in modern lives. In the developing countries, we find that the accidents are occurring in the three major areas. So, we are studying about the prevention of accidents. Where are the accidents occurring? Accidents occur on the roads, they also occur at home, and also at the place of work. So, at home and work, road, home, and at workplace, the three major places wherein the accidents occur. It should be the concern of the like the engineering department and the also this police department to enforce the rules of road safety. So the safety education regarding this road safety have to be enforced by the police department. And also accidents are also found in railways, mines, factories. The management of a safe environment should be done in these areas. The predominant factor which is found in accidents is the carelessness what the people show. And this problem can be tackled through health education. If we educate the people, they will show less carelessness and we can prevent the accidents. Moving on to use of health services. Lastly, we have use of health services. Inform the people use of health services, wherein we see that we have to inform the people about the health services which are available in the community. We see that in the rural areas, people do not know what health services are available in the community. These studies have shown that the public's attitude towards health services is very poor. There is a lot of communication gap between the public and the state health administration. And because of this, they are not being aware of the health services which are being available to them, like the screening programs, immunization, family planning services. So what is the aim of the health education is, we have to guide the people, bring awareness of the people regarding the health services which are available to them in the community, and also how they can utilize them and use these healthcare resources. I hope the contents of health education is clear. Let us summarize all of them without saying. So, we studied human biology, that is, regarding the exercise, rest, sleep, and etc. Then, next we studied about human biology. Then comes nutrition and hygiene. Nutrition, we know the balanced diet have to be the people have to choose balanced diet, and they should promote the good dietary habits. Then regarding the hygiene, we saw that personal hygiene, and we had the environmental hygiene, wherein there was domestic hygiene and also community hygiene. Then next we studied about family health, and you can memorize this like this, guys: family health and mental health together. So I will show you with this, you will understand better. So we see that human biology is done. First one is human biology. The second, you can remember nutrition and hygiene together. Nutrition and hygiene. Family health, mental health. These two together. Family health and mental health. Okay. Then disease prevention, prevention of accidents. Disease prevention and control, prevention of accidents. Nutrition and hygiene together. Family health and mental health together. Disease prevention and prevention of accidents. And lastly, disease prevention and use of health services. Once the diseases and accidents occur, what do? Health services provided. So this is how you can remember. Let us tell it without seeing now. What are that? What are those? Human biology, nutrition and hygiene. Followed by nutrition and hygiene, we had family health and mental health. Then the disease prevention and control and prevention of accidents. And lastly, the use of health services. I hope it's clear. With this, we come to an end of the contents of health education. If you like the video, hit the like button and subscribe. Thank you.